Schizophrenia and psychotic disorders from the DSM video. So we're going to first start with schizophrenia. Schizophrenia is the most chronic and disabling of the severe mental disorders, associated with abnormalities of brain structure and function, disorganized speech and behavior, and hallucinations. It is sometimes called a psychotic disorder or a psychosis. Medications are the mainstay of treatment for schizophrenia. Drug therapy for the disorder, however, is complicated by several factors. The unpredictability of a given patient response to specific medications, the number of potentially troublesome side effects, the high rate of substance abuse among patients with schizophrenia, and the possibility of drug interactions between antipsychotic medications and antidepressants or other medications that may be prescribed for the patient. Alternative and complementary therapies that are being investigated for the treatment of schizophrenia include ginkgo biloba, an Asian shrub, and vitamin therapy. One Chinese study reported that a group of patients who had not responded to conventional antipsychotic medications benefited from a 13-week trial of ginkgo extract, with significantly fewer side effects. This is really encouraging to hear. Vitamin therapy is recommended by a naturopathic practitioner on the grounds that many hospitalized patients with schizophrenia suffer from nutritional deficiencies. Moving on, we're going to 95. Catatonia is a disturbance within a patient's motor behavior. It is most well known for people who remain rigid and immobile for an extended period of time. Sometimes this kind of immobility will last for days, weeks, or longer. It may also refer to a kind of purposeless motor behavior that is not triggered by anything in a patient's environment. Catatonia may be the result of schizophrenia, depression, or another general medical condition. When it comes to treatment of catatonia, it is crucial to move quickly for long-lasting positive results. Treatment includes pharmacotherapy and electroconvulsive therapy. It may not be that food and water need to be given through parenteral nutrition because the patient will not eat themselves. Let's see, 95. 95. Oh, actually, 96. Schizophreniform disorder. Schizophreniform disorder is a time-limited... Let me just adjust this really quick. There we go. A little bit off kilter there. Okay. Just go like that. Oh, that's perfect. Schizophreniform disorder is a time-limited illness wherein the sufferer has experienced at least two of the major symptoms of psychosis for longer than 1 month, but fewer than 6 months. Hallucinations, delusions, and strange bodily movements, or lack of movements, catatonic behavior, are all symptoms that may be observed. The main line of treatment for SFD is antipsychotic medication. These medications are often very effective in treating SFD. Mood-stabilizing drugs similar to those in bipolar disorder may be used if there is little response to other interventions. Postpartum psychosis is also treated with antipsychotics and possibly hormones. Supportive therapy and education about mental illness is often valuable. The most useful interventions in culture-bound syndromes are those that are societally prescribed. Current research has found that although prevention of psychotic disorders is difficult to accomplish, the earlier treatment begins, the better the outcome. The earlier the treatment begins, the better the outcome. To say that more fluidly. Therefore, efforts are more generally focused on early identification of SFD and other psychotic spectrum disorders. Moving on, 97. It's a little tricky to do this. Here lies another disorder which is very difficult to properly identify and treat appropriately. The disorder involves psychotic symptoms and severe mood disorders and resembles many other disorders as a result. The importance to note here is mood disturbance. It is also important to understand that those affected with schizoaffective disorder experience psychotic periods without simultaneous mood fluctuations. It is the difference between mood swings and long-term mood disturbance. New generation, atypical, and novel antipsychotic medications are very effective in schizoaffective disorder treatment. These medications often terminate the psychotic symptoms or flare-ups that the patient may be experiencing. Research has shown that those with schizoaffective disorder were associated with increased BMI, which is related to being overweight and obesity. They showed that those affected by the disorder did have a higher risk of becoming overweight. Identifying predictors in patients can help prevent obesity and other health issues that may come along. Let's see. All right, 98. So we got 98. Delusional disorder. Delusional disorder is characterized by the presence of recurrent, persistent, non-bizarre delusions. Unlike most other psychotic disorders, the person with delusional disorder typically does not appear obviously odd, strange, or peculiar during periods of active illness. Yet the person might take unusual choices in day-to-day life because of the delusional beliefs. The delusional disorder treatment often involves atypical, also called novel or newer generation, antipsychotic medications, which can be effective in some patients. Risperdal, Seroquel, Zyprexa are all examples of atypical or novel antipsychotic medications. If agitation occurs, a number of different antipsychotics can be used to conclude the outbreak of acute agitation. Cognitive therapy has shown promise as an emerging treatment for delusions. The cognitive therapist tries to capitalize on any doubt the individual has about the delusions, then attempts to develop a joint effort with the sufferer to generate alternative explanations, assisting the client in checking the evidence. This examination proceeds in favor of the various explanations. 99. So here we go. 9. The disorder is also known as the folly of two. This is called shared psychotic disorder, by the way. And it is a rare case in which a normally healthy person takes on the delusions of a person who actually has a psychotic disorder. Here is an example. A schizophrenia affected person believes that giant eagles are coming to snatch them up, and by proximity another person begins to believe the same, although they do not actually have the biological indicators of schizophrenia. This typically happens in close relationships that have been going on for a long time and the balance of power is skewed. The person who takes on the symptoms is generally in a submissive relationship to the originally affected person. Family therapy is common treatment because this tends to be in close relationships that shared psychotic disorders develop in. These therapies are important because they improve communication and the power dynamics that may have led to this disorder. Medication includes tranquilizers like Ativan or Valium. Current research is finding the separation of the two affected individuals is not effective and requires more intensive neuroleptic treatment. All right. This is 100. 100. Oh, man, I'm glad we made it out of the 9s because it's kind of hard to do on the fingers. So, substance medication-induced psychotic disorder. Prominent psychotic symptoms, i.e. hallucinations and or delusions, determined to be caused by the effects of a psychoactive substance is the primary feature of a substance-induced psychotic disorder. It's a lot of words. A substance may induce psychotic symptoms during intoxication, while the individual is under the influence of the drug, or during withdrawal, after an individual stops using the drug. The treatment is determined by the underlying cause and severity of the psychotic symptoms. However, treatment of a substance-induced psychotic disorder is often similar to treatment for a primary psychotic disorder such as schizophrenia. Appropriate treatments may include psychiatric hospitalization and antipsychotic medication. There is very little documented regarding prevention of substance-induced psychotic disorder. However, abstaining from drugs and alcohol or using these substances only in moderation would clearly reduce the risk of developing this disorder. In addition, taking medication under the supervision of an appropriately trained physician should reduce the likelihood of medication-induced psychotic disorder. Finally, reducing one's exposure to toxins would reduce the risk of a toxin-induced psychotic disorder. Moving on. 101. What is attenuated psychosis syndrome? This is a relatively recent disorder, only just included in the DSM-5. It is somewhat difficult to define and may go somewhat diagnosed or lumped in with another diagnosis with the psychotic disorders. APS is a mental condition in which the affected suffers significant distress by the onset of psychotic-like symptoms, but not fully in accordance with schizophrenia, schizoaffective disorder, etc. Attenuated means weakened, which may help make sense of the disorder and its naming. The feelings of distress may include a lack of control over one's own mind, thinking that others may be able to read your mind, the perception of sounds louder than they really are in reality, speaking at a rate that is faster or slower than usual, or simply using words when you speak. Using odd words when you speak. Attenuated psychosis syndrome may mirror that of the previously mentioned schizophrenia and psychotic disorders. However, it may be more important to discuss the research being done on attenuated psychosis syndrome, or how it is used to be called psychosis risk, or how it used to be called psychosis risk. Essentially, the entire mental health community does not want APS to be recognized in the DSM because it is still so ambiguous that it may lead to stigma, misdiagnosis, unnecessary medications, and so forth. It seems we have much to learn about APS before we can think about entirely preventing psychosis. Before we're actually able to. Finally, we have 102. It's brief psychotic disorder. Brief psychotic disorder is a short-term, time-limited disorder. An individual with brief psychotic disorder has experienced at least one of the major symptoms of psychosis for less than 1 month. Hallucinations, delusions, strange bodily movements or lack of movements, catatonic behavior, peculiar speech, and bizarre or markedly inappropriate behavior are all classic psychotic symptoms that may occur in brief psychotic disorder. Antipsychotic medications are very effective in ending a brief psychotic episode. A number of different antipsychotics are used for the purpose of terminating acute psychotic episodes. Just going to continue here. Haldol is most commonly used if the psychotic symptoms are accompanied by agitation. Agitation is a state of frantic activity that is often accompanied by anger or fearfulness when in an agitated state. The client is more likely to cause harm to self or others. In women who have experienced brief postpartum psychosis, one prevention option is to forego having additional children. If postpartum psychosis has occurred in the past, in subsequent pregnancies, the physician may be proactive in prescribing an antipsychotic medication regimen to be taken in the postpartum period in order to prevent psychotic symptoms from reoccurring. That's all for schizophrenia and psychotic disorders. Thanks for joining us on DSM video. And by us, I just mean me because I'm not crazy. At least I don't think so. You'd think I'd be able to diagnose myself at this point, if I was. Anyway, see you next time. We're going to be talking about neurodevelopmental disorders.